notice
that I ain't going
nowhere.
I ain't blowing no smoke. I mean, I've been sober, but you should've known it, that I wasn't going.
Alright, hello guys, welcome back to my channel. Welcome back to another video. It's your RN Steph. So guys, today I'll be talking about diabetes. I've been getting some requests as to what I should present on. Somebody requested that I do one on high blood pressure, diabetes, and polycystic ovaries. So today I'll be doing diabetes. But before I begin, I would just like to remind you to share my videos, like, subscribe, and to comment in the comment section of the video for any feedbacks. Alright, so what is diabetes? So diabetes is a disease that occurs when your blood glucose, also called your blood sugar, is too high. Glucose is your body's main source of energy, and your body can make glucose, but glucose also comes from the food you eat. Insulin is a hormone made by the pancreas that helps the glucose to get into your cells to be used for energy. If you have diabetes, your body doesn't make enough or any insulin, or doesn't use the insulin properly. Glucose then stays in your blood and doesn't reach your cells. Diabetes raises the risk of damage to the eyes, the kidneys, the nerves, heart, and it is also linked to some types of cancer. Taking steps to prevent or manage diabetes may lower your risk of developing certain health problems. So what are the different types of diabetes? So there are different types of diabetes. So if you have type 1 diabetes, your body makes little or no insulin. Your immune system attacks and destroys the cells in your pancreas that makes insulin. Type 1 diabetes is usually diagnosed in children and young adults, although it can appear at any age. People with type 1 diabetes need to take insulin every day to stay alive. Then we have type 2 diabetes. If you have type 2 diabetes, the cells in your body don't use the insulin properly. Pancreas may be making insulin, but is not making enough insulin to keep your blood glucose level in the normal range. Type 2 diabetes is the most common type of diabetes. You're more likely to develop type 2 diabetes if you have risk factors such as overweight or obesity and the family history of the disease. You can develop type 2 diabetes at any age, even during childhood. So you can delay or prevent type 2 diabetes by knowing the risk factors and taking steps towards a healthier lifestyle, such as losing weight or preventing weight gain. Yes, I know, easier said than done. Then we have gestational diabetes, and this is a type of diabetes that develops during pregnancy. Most of the time, this type of diabetes goes away after the baby is born. However, if you have had gestational diabetes, you have a higher chance of developing type 2 diabetes later in life. Sometimes diabetes diagnosed during pregnancy is type 2 diabetes. Also, we have pre-diabetes. People with pre-diabetes have blood glucose levels that are higher than normal, but not high enough to be diagnosed with type 2 diabetes. If you have pre-diabetes, you have a higher risk of developing type 2 diabetes in the future. You also have a higher risk for heart disease than people with normal glucose levels. So we are going to go into some of the signs and symptoms of diabetes. Some of the signs and symptoms of diabetes includes frequent urination, especially at night. The body tries to flush out excess sugar through the urine. We have excessive thirst, the body loses fluid as it tries to eliminate excess sugar, leading to dehydration. Unexplained weight loss. The body can't properly use glucose for energy, so it starts breaking down fat and muscle tissue. Increased hunger. The body can't use glucose, so it sends signals that the body is hungry even if you've eaten. Blurred vision. High blood glucose levels can damage the small blood vessels in the eyes. Slow healing sores. High blood sugar impairs the body's ability to heal. So we find that persons with diabetes, sometimes they don't even know that they have a sore on their foot, because the foot is one of the least places that persons tend to pay attention to on their body. And then when they do come after they become so ill, most of the time we realize that they end up with an amputated toe or an amputated foot, and this is because diabetes causes slow healing sores, and it also causes what you call damage to the nerves. So persons can't really feel that there is a sore on their foot until it gets so bad that it has to be amputated. So persons with diabetes should have regular checkups, monitor their foot regularly to ensure that there is no cuts. And if you do realize you have a cut, to go to the health center or the GP to keep dressing it and monitoring it so it doesn't break down any further. Okay. Other complications of diabetes includes cardiovascular disease. So diabetes increases the risk of heart attack, stroke, and other heart problems. And we'll go into a little details. We'll go in a little bit as to how diabetes affects the heart. And it also causes nerve damage, like I said before. So you would end up with numbness, tinglings, and pain in the arms and in the feet. Alright, so let us go into diabetes and the heart. Right, so now we're going to go into how diabetes affects your heart. So type 1 and type 2 diabetes cause unused glucose or sugar to stick to your red blood cells and build up in your blood. So this buildup can damage the arteries that carry blood, oxygen, and nutrients around your body. When arteries get damaged, it's easier for fatty materials to stick to the artery walls, and this can clog the arteries and reduce the space for blood to flow properly. If the arteries carrying blood to your heart gets clogged, it can lead to a heart attack. If the arteries carrying blood to your brain gets clogged, it can lead to a stroke. So let me tell you how now you can visualize this. So imagine having a pipe that carries your water system. If it doesn't get cleaned by the various authorities, then over time you will have slug building up in the pipes, and what you notice is that your flow of water will be less. So it's the same with the arteries and the other vessels in the body. Over time, the sugar, they stick to the blood cells and they clump up together. So you realize that it's in the heart needs blood, the muscles of the heart needs blood, and if the arteries are blocked, then that area of the heart will have reduced blood. And if there's reduced blood to that area of the heart, the muscle will die, and that will result in what we call a heart attack. And it's the same with the brain. If the blood vessels in the brain becomes blocked, or we have reduced blood flow going to the brain, you'll end up with a stroke. And it's the same with the eyes. If the tiny blood vessels in your eyes become blocked, then you will end up with blindness or blurred vision. So this is how diabetes affects the various arteries and blood vessels in your body, right? So now we're going to go into some of the ways we can manage or prevent diabetes. So if you are diabetic, Eating a balanced diet and limiting certain foods is very important. Your doctor will usually recommend you eat more whole foods, reduce the amount of high sugar, high fat, and high salt food and drinks, and eat regularly because skipping meals can cause your blood sugar levels to go too low. Some of the foods your doctor might recommend you include fruits and vegetables, whole grain starchy foods like wholemeal, bread instead of white, brown rice and oats, protein foods such as beans, pulses, nuts, eggs, lean meat, and fish including oily fish like mackerel and salmon, lower fat and sugary dairy, and dairy alternatives like low-fat cheese, natural or unsweetened yogurt, and semi-skimmed milk. Well, I know it's easier said than done because majority of the foods that are what we would say nice are the ice cream, the chocolate, the candies, the processed foods and fast foods, and then you'd want to just eat those because they're nice. But I still have to endorse eating healthy as a healthcare professional, but it's easier said than done. So, exercise recommendations. Being physically active is another way to control your blood sugar levels. Exercise helps to lower the amount of glucose or sugar in your blood because muscles need to use more of it. This can reduce your risk of developing heart and circulatory diseases and other complications. Physical activity can also boost your mood, help you feel less tired, and it can be fun too. Adults in the UK are recommended to get around 2.5 hours of exercise a week. A session could be as little as 5 or 10 minutes. Even the smallest changes can have great results. So as long as you're doing something to get you out of breath, it can be anything including riding a bike. It can be anything including swimming, riding a bike, walking your dog, pushing a lawnmower, So any little thing that can get you moving. So the next one is managing your weight, which sometimes is one of the most difficult ones to do. So having a healthy weight is the best way to manage your blood pressure, cholesterol level, and diabetes. If you are living with excess weight or obesity and diabetes, your doctor will usually recommend making small lifestyle changes to have a healthy weight. If you are worried about your weight, you can visit your local GP service or healthcare, whichever health facility you have, and they may be able to give you advice onto how you can lose weight, or they'll signpost it to various organizations or website that can help with weight loss. So guys, the best way to prevent type 2 diabetes is by eating a healthy, balanced diet, staying active, and having a healthy weight and waist size. And if your doctor prescribe you medication to take for your blood sugar, remember compliance is key. So it doesn't make any sense you have the medications and you want to take them when you think your sugar is high. That won't help, and that won't help to manage it. And over time, if your sugar is managed properly, they may even take you off the medications and just recommend lifestyle changes alone. So just remember to continue monitoring your blood sugar levels, and you can buy a simple glucometer. They can be found at any local pharmacy, even on Amazon. Alright, so the glucometer, and it comes with some strips, and sometimes you have to buy extra strips because the ones that come in the pack is nothing much. And then you have your lancet and you get your needles. So all you do, you put your needle in your lancet, right? Then pierce the finger. Then you put your strips in. Put your strip in, and then it will pop up and it will be asking you for the blood, and then you just put the blood on and it will give you a reading. Alright, and some packets actually come with the range So even on my strip bottle, it would tell you the range that your blood sugar should be, and it depends on if you are diabetic or if you are not diabetic, what your range should be. But if you are non-diabetic, it's normal to try and keep it between 3 to at least 5 grams per deciliter. Alright, or milligrams per deciliter. So that's it on diabetes. If you have anything to add, you can let me know in the comment section. Yeah, and if you have any other recommendations as to what video you would like to see, you can also add in the comment section. Thank you for watching. Remember to like, share, and subscribe, and I'll see you in the next video.